Have you ever stopped to think that something as ordinary as your bedtime routine could be quietly putting your health and even your life at risk? It may sound extreme, but research from the Centers for Disease Control and Prevention, CDC, shows that over 70,000 seniors pass away in their sleep each year in the United States alone. The frightening truth is that many of these deaths are not simply due to aging itself, but are directly connected to dangerous sleep habits most people never realize are harmful. As the years go by, your body grows more fragile to even the smallest changes. After age 60, your heart, brain, and breathing systems don't respond the same way they once did. Sleep cycles shift, muscle strength declines, and the risks tied to normal nightly routines become much more severe. Yet countless seniors stick with these old habits, unaware that they may be undermining their health every single night. So what are these overlooked bedtime dangers? Which habit is the silent killer behind so many unexpected emergencies? And what small adjustments can you make starting tonight to protect yourself and those you love? In this video, we'll uncover 7 deadly sleep mistakes that have already claimed far too many lives this year. Habit number 2 is especially dangerous. You don't want to miss it. Don't worry, I'll also reveal the safer choices you can make so you rest soundly and securely. Before we get started, welcome if this is your first time here. How old are you right now? Drop your age in the comments. We are reading and replying to each single one. Hit like, subscribe, and drop your country in the comments so we know where our family is growing from. Let's begin. 7 dangerous sleep habits you must avoid. Habit 7, eating late at night. Now let's talk about a habit that feels harmless, even comforting, but can quietly undermine your health. Eating late at night. For many seniors, grabbing a snack before bed becomes routine. Maybe a sandwich, some leftovers, or even something sweet to settle the stomach. But while it may feel satisfying in the moment, this habit can set off a chain reaction of problems that stretch far beyond simple indigestion. As we age, our bodies don't handle food the way they once did. Metabolism slows down, digestion takes longer, and insulin sensitivity declines, making it harder to regulate blood sugar. Late-night eating forces the digestive system to stay active, while the rest of the body is trying to rest and repair. Instead of entering deep restorative sleep, your body diverts energy toward breaking down food. This not only disrupts sleep quality, but also places unnecessary strain on vital organs such as the heart, pancreas, and liver. One of the most immediate risks is acid reflux. When you lie down soon after eating, stomach acid can flow back into the esophagus, causing burning pain and discomfort. For seniors, repeated episodes of reflux can do more than disturb sleep. They can damage the esophagus over time, contribute to chronic inflammation, and even increase the risk of aspiration pneumonia if food particles or acid are inhaled into the lungs while sleeping. Research in the American Journal of Gastroenterology confirms that eating within 3 hours of bedtime significantly raises the likelihood of nighttime reflux. But it doesn't stop there. Late-night meals, especially those high in refined carbs or sugar, can trigger sharp increases in blood sugar. Older adults are already more prone to insulin resistance, so these nighttime spikes may contribute to type 2 diabetes or complicate existing conditions. A 2020 study in the Journal of Clinical Endocrinology and Metabolism found that late eating was directly linked to higher glucose and insulin levels the next morning, particularly in older individuals. Your heart also pays the price. Normally, blood pressure dips during deep sleep to give the cardiovascular system a break. Eating late can interfere with this process, causing non-dipping blood pressure, which raises the risk of heart attacks and strokes. Heavy or fatty meals can also trigger arrhythmias, dangerous irregular heartbeats, especially in seniors with pre-existing heart conditions. The good news is that small adjustments make a big difference. Aim to finish dinner at least 3 hours before bedtime and choose lighter evening meals, lean protein, vegetables, or whole grains instead of fried or sugary foods. If hunger strikes before bed, keep it light, like a small piece of fruit, plain yogurt, or a handful of nuts. By giving your body time to digest before sleep, you'll protect your heart, steady your blood sugar, reduce acid reflux, and wake up feeling more rested. In short, you're not just avoiding discomfort, you're protecting your long-term health with every mindful choice. Habit 6. Drinking too much water before bed. We'll start with a habit that sounds perfectly healthy, but can be surprisingly harmful if done at the wrong time. Drinking water right before bedtime. Hydration is essential at every age, but for seniors, it's especially important because water supports every single function in the body. It keeps your skin elastic, cushions your joints, regulates temperature, helps with digestion, and ensures your cells stay energized. Without enough water, seniors risk dehydration, fatigue, constipation, and even confusion. But here's the catch. Although hydration is critical, consuming too much water in the late evening can quietly set you up for dangerous problems overnight. As we get older, our bodies process fluids differently. The kidneys gradually lose efficiency, which means filtering excess fluid becomes harder. At the same time, the bladder's ability to hold urine decreases, and the signals to empty it grow more urgent. For someone over 60, a single large glass of water, or even tea or juice, within 1 to 2 hours of bedtime almost guarantees a trip to the bathroom in the middle of the night. That might sound harmless, but nighttime bathroom visits are a major risk factor for falls among older adults. Picture this. You're half asleep, your blood pressure dips as you stand up, your balance isn't as sharp as it once was, and the room is dark. One misstep can cause a serious fall. The CDC reports that falls are the leading cause of injury-related hospital visits among seniors, and a large portion of those accidents happen at night during rush trips to the bathroom. But falls aren't the only issue. Waking up repeatedly breaks your natural sleep cycle. Instead of spending enough time in deep, restorative sleep, the stage where your brain clears toxins and your body repairs tissues, you're jolted awake, sometimes multiple times. Chronic disruption of this cycle has been linked to poor memory, increased inflammation, weakened immunity, and even a higher risk of cognitive decline, including dementia and Alzheimer's disease. There's also a hidden impact on heart health. Processing excess fluids at night places extra strain on the cardiovascular system, potentially causing blood pressure fluctuations and, in vulnerable seniors, triggering irregular heart rhythms. The solution isn't to stop drinking water, it's about timing and moderation. Hydrate well during the day, taper off in the evening, and avoid large amounts at least 2 hours before bed. If you're thirsty at night, sip small amounts instead of downing a full glass. Also, avoid diuretic drinks like coffee, black or green tea, and certain juices late in the day since they increase urine production. And if you do need to get up at night, keep your path to the bathroom clear and well lit to prevent accidents. By adjusting when and how much you drink, you can stay hydrated, protect your sleep, and dramatically lower your risk of nighttime emergencies, all while enjoying the health benefits of proper hydration. Habit 5. Sleeping in the wrong position. Most of us have a preferred sleeping position that we rarely question. Yet the way you sleep could be silently putting your health at risk, especially as you age. For seniors, posture during sleep can influence breathing, heart health, and even brain function in ways that shouldn't be ignored. The most concerning position is sleeping on your back, or the supine position. Though comfortable, it creates multiple health hazards. Gravity causes the tongue and throat tissues to fall backward, narrowing the airway and restricting airflow. This makes snoring and sleep apnea far more likely. Research from the Mayo Clinic's Sleep Disorder Center shows that back sleeping can worsen breathing issues by up to 40% compared to side sleeping. Interrupted breathing during the night does more than disrupt rest. Reduced oxygen flow can trigger sleep apnea episodes, leading to high blood pressure, irregular heart rhythms, and a greater risk of heart attacks or stroke. A Journal of Clinical Sleep Medicine study found seniors who sleep on their backs face a 22% higher risk of nocturnal cardiac events compared to side sleepers. For those with reflux or hiatal hernia, lying on the back increases the chance of stomach acid reaching the esophagus. This silent reflux damages the esophageal lining and, if inhaled, can cause aspiration pneumonia. Over time, it may even raise the risk of esophageal cancer. Neurologically, the risks are just as troubling. A study from Stony Brook University revealed that back sleeping reduces the brain's ability to clear out waste by up to 63%. That means harmful proteins linked to Alzheimer's and dementia are not flushed out efficiently, potentially accelerating cognitive decline. Sleeping on the right side also isn't ideal, as it can press on the heart's major vessels, worsening circulation in those with existing heart issues. The safest position? Experts agree on the left side. This posture improves circulation, reduces reflux, and supports the brain's detox system, protecting both heart and cognitive health. To make the transition easier, use a pillow between your knees to align the spine and another behind your back to prevent rolling. Elevating the head of your bed slightly can also reduce reflux symptoms. Training yourself to favor left-side sleeping may lower your risks of heart complications, nighttime breathing issues, and cognitive decline, helping you wake up healthier and more refreshed each morning. Habit 4. Sleeping in a hot room. Everyone wants comfort at night, especially as they get older. It feels natural to turn up the heat, add thick blankets, or shut every window to keep the cold away. But here's the problem. Sleeping in a room that's too warm isn't just uncomfortable, it can quietly put your health at risk. For seniors, bedroom temperature isn't about luxury, it's about safety. Your body naturally cools down as you fall asleep. This drop in core temperature signals the brain to enter deep, restorative sleep. But if your bedroom is too hot, generally above 70 degrees Fahrenheit, 21 degrees Celsius, that process is disrupted. Instead of drifting easily into rest, your body works overtime to release heat. The result? Tossing, turning, shallow sleep, and waking up groggy instead of refreshed. The health effects go much deeper. Seniors are less efficient at regulating body temperature, making overheating more likely. Research published in the American Journal of Geriatric Psychiatry shows that older adults sleeping in rooms warmer than 70 degrees Fahrenheit lose up to 30% of their slow-wave sleep, the phase most critical for memory, immune strength, and physical repair. Missing this crucial stage can trigger a domino effect: increased inflammation, higher blood pressure, weaker immunity, and even a faster rate of cognitive decline. Over time, poor quality sleep raises risks of heart disease, diabetes, and dementia. The same study also linked warm sleep environments to faster memory loss and reduced ability to fight infections. Another hidden danger is dehydration. Seniors often don't feel thirst as strongly, and sweating during hot nights worsens fluid and electrolyte loss. This can thicken the blood, raising the chance of blood clots, arrhythmias, and even stroke. For those with heart or lung conditions, the extra stress of cooling the body can spark serious complications, from breathing trouble to heart attacks. So what's the safe zone? Experts recommend a bedroom between 60 and 67 degrees Fahrenheit, 15 to 19 degrees Celsius. Choose light, breathable bedding like cotton sheets, and avoid heavy comforters or electric blankets that trap heat. If you get chilly, layer thinner blankets you can remove easily. Adding a fan or cracking a window can improve circulation and keep the room fresh. By keeping your room cool, you're not just improving comfort, you're protecting your heart, brain, and overall well-being night after night. Habit 3. Getting out of bed too quickly. Have you ever woken up in the night, swung your legs out of bed, and suddenly felt dizzy or as if the room were spinning? If so, you're not imagining it. For seniors, standing up too quickly can be far more than a moment of discomfort. It's a dangerous habit that leads to countless falls, injuries, and hospital visits every year. The main cause is a condition called orthostatic or postural hypotension, a sudden drop in blood pressure when moving from lying down to standing. As we age, the body becomes less efficient at stabilizing blood pressure during position changes. Blood briefly pools in the legs, and the brain is momentarily deprived of oxygen-rich blood. That's when you feel lightheaded, faint, or lose balance. This is more than a nuisance. It's a proven health risk. A study in JAMA Internal Medicine showed that older adults with orthostatic hypotension face a significantly higher risk of falls, fractures, and even early death. Falls are the leading cause of injury-related hospitalizations among seniors, and many happen at night or early morning when blood pressure is already lower and the body hasn't fully adjusted from sleep. The consequences can be devastating. Hip fractures, head trauma, and broken bones are common and often require long, painful recoveries. In many cases, a single fall can lead to lasting loss of mobility, reduced independence, or dangerous complications. That's why this seemingly small habit deserves serious attention. The good news is that prevention is simple. Instead of jumping up immediately, sit on the edge of the bed for a moment. Flex your feet, move your legs, and take a few deep breaths to help circulation catch up. Keeping a small glass of water by your bed can also help, since dehydration worsens dizziness. Lighting is another crucial factor. Use night lights or motion sensor lamps to brighten your path and remove tripping hazards like loose rugs or clutter. Wearing sturdy, non-slip slippers instead of socks reduces the risk of slipping. If you take medications that lower blood pressure, ask your doctor whether adjustments are needed. By moving slowly and preparing your body before standing, you can avoid dangerous falls and protect your long-term independence. Remember, getting up carefully isn't just about comfort, it's a life-saving habit. Habit 2, ignoring snoring, breathing stops, or insomnia. Snoring is often dismissed as nothing more than an irritating noise, but for seniors, it can be a red flag for something much more serious. Those nighttime sounds or the pauses in breathing that sometimes accompany them may signal hidden sleep disorders that silently damage your health. Ignoring issues like snoring, breathing interruptions, or persistent insomnia can open the door to life-threatening complications. One of the most dangerous and overlooked conditions is obstructive sleep apnea. This occurs when throat muscles relax too much during sleep, narrowing or even blocking the airway. Breathing may stop for seconds at a time, sometimes hundreds of times per night. Each pause drops blood oxygen levels, forcing the heart to work harder. Over time, this constant strain raises blood pressure, disrupts heart rhythms, and dramatically increases the risk of stroke and heart attack. The statistics are sobering. The Sleep Heart Health Study found that untreated sleep apnea raises the risk of fatal heart attacks by 30% and strokes by up to 60%. Even more concerning, about 40% of seniors may have sleep apnea, but as many as 80% of cases remain undiagnosed. Many older adults simply think their restless nights or loud snoring are normal parts of aging, but the risks extend beyond the heart. Sleep apnea robs the brain of the restorative rest it needs. Chronic oxygen dips and sleep interruptions are linked to memory loss, confusion, and accelerated cognitive decline. Research shows that seniors with untreated moderate to severe sleep apnea can develop brain shrinkage in areas responsible for memory and decision-making at nearly triple the normal rate. Warning signs aren't always obvious to the sleeper. Loud, frequent snoring, gasping, choking, or long pauses in breathing are often noticed by a partner or family member. Other red flags include waking with headaches, dry mouth, excessive daytime fatigue, or dozing off during quiet activities. Chronic insomnia, trouble falling or staying asleep, can also indicate deeper cardiovascular, hormonal, or neurological problems while weakening immunity and raising stress. The good news? Effective treatments exist. CPAP therapy, weight management, and lifestyle adjustments can dramatically lower risks. Studies show that treating sleep apnea can cut cardiovascular risk by as much as 42% in seniors. Snoring and insomnia aren't just nuisances. They're signals your body is sending. Listening to those signals and seeking help could protect your brain, your heart, and your future quality of life. Habit 1. Taking certain medications before bed. For many seniors, taking pills before bedtime is simply part of the nightly routine. A sleeping aid to help drift off, a blood pressure tablet, or a pain reliever for stiff joints. It all seems harmless. Just another step before turning out the lights. But here's the truth. Certain medications taken at night can quietly put your health at risk, and the dangers often increase with age. Sleeping pills and sedatives are among the most concerning. Benzodiazepines such as diazepam, clonazepam, or alprazolam work by slowing down the central nervous system, helping you relax. While they may promote sleep, they also slow breathing and dull reflexes. For seniors, particularly those with heart or lung conditions, this can be risky. A study in the British Medical Journal revealed that older adults who use benzodiazepines regularly face a higher risk of falls, fractures, and even death. Worse, their effects can carry into the next morning, leaving you dizzy, confused, and unsteady, prime conditions for dangerous accidents. It's not just sleeping pills. Some antidepressants and muscle relaxants, often taken at night, interfere with the deep sleep cycles your brain needs for memory and repair. Over time, this can worsen forgetfulness and contribute to cognitive decline. Painkillers add another layer of risk. NSAIDs like ibuprofen or diclofenac, when used frequently, place strain on the kidneys and liver and raise the risk of internal bleeding, especially when combined with other medications. Blood pressure medications can also be tricky. While nighttime dosing helps some patients, for others it pushes blood pressure too low during sleep. This can reduce oxygen flow to the brain, triggering dizziness, fainting, or even stroke. A hypertension journal study confirmed that the timing of blood pressure medication has a major impact on cardiovascular safety. Then there's the danger of drug interactions. Seniors process medications more slowly, and combining sedatives, painkillers, or multiple prescriptions without guidance can magnify side effects, leading to confusion, extreme drowsiness, or life-threatening complications. The solution starts with awareness. Always check with your doctor or pharmacist before changing medication timing. Ask about safer alternatives if you experience dizziness, fatigue, or mental fog. Avoid unnecessary sedatives and consider natural sleep supports such as herbal teas, breathing exercises, or relaxation routines. If you take blood pressure drugs at night, monitor your readings and report unusual changes. By making small, informed adjustments to your medication routine, you can lower your risks, protect your brain and heart, and enjoy safer, more restorative sleep. To wrap things up, it's clear that even the smallest changes to your bedtime routine can dramatically improve your health, safety, and overall quality of life. These 7 habits may seem minor, but left unchecked, they can quietly add up to serious risks. The good news? You now have the power to make smarter choices starting tonight. Whether it's keeping your room cooler, limiting fluids before bed, or reviewing your medications with your doctor, each adjustment is a step toward deeper, safer, and more restorative sleep. Now, we'd love to hear from you. Have you ever fallen into one of these habits without realizing it? Or do you have your own tip that's helped you sleep better? Share it in the comments below. You might just help someone else. And don't forget to hit like, subscribe, and join our growing family for more science-backed health tips. Thank you for watching and supporting our channel.